I'm now delighted to welcome Dr. Busiku Hamenza from the Zambia's Ministry of Health. Dr. Busiku is currently the Assistant Director at the National Malaria Elimination Center. He has been working with the National Malaria Elimination Center in Zambia for more than 10 years, and he specializes in malaria programming from the planning stage to costing, implementation, monitoring, and evaluation. He oversees all malaria programmatic surveillance, monitoring, evaluation, and program management, including the rollout and the strengthening of Zambia's Malaria Scorecard. We're very excited to have Dr. Busiku with us today as he talks about Zambia Malaria Scorecard. Zambia is a great example of how scorecards can improve and gain maturity as they move from rollout to institutionalization and decentralization. Dr. Busiku will make a short presentation and then we will watch a short film about the Zambia Malaria Scorecard.
Greetings. My name is Busiku Hamenza from the National Malaria Elimination Center in Lusaka, Zambia. I'm going to take you through a few slides just to show you our experiences as a country with regards to the scorecard and the Workplan Manager. So as a country, we are committed to pushing for malaria elimination. Previously, we had a strategic plan that was targeting elimination of malaria in Zambia. This strategic plan ran us from 2017 to 2021. Currently, we are working on the development of a new strategic plan that will take us from 2022 to 2026. And this we are doing post-malaria programmatic review. So essentially, the program in Zambia was transformed from one that was focused on malaria control to one that was poised towards malaria elimination. Zambia adopted and launched the Malaria Ends With Me campaign to really personalize the fight against malaria across the country and at all levels. Our former president, His Excellency President Edgar Lungu, appointed an End Malaria Council, which was a strategically placed body that encompassed and included various top-line ministries, traditional leadership, religious leadership, as well as top business leadership to try and advocate and push for malaria elimination in Zambia. This council was established in the year 2019, and immediately after that, an End Malaria Fund was set up, which was the conduit in which the resources that were generated by the End Malaria Council would be deposited and dispersed to needy areas within the program. So why did we get to start using this Malaria Scorecard? This tool has helped us to track the progress that we are making with regards to our implementation of malaria programs. It also has allowed us to be able to identify any challenges and bottlenecks. Additionally, this particular tool also helps us to manage our operational plans, our implementation, and monitor progress towards those planned activities. So essentially what this tool can do is that it tracks national and subnational performance, and this strengthens our accountability and our drive for action. It also allows us to have real-time data in terms of activity progress at all levels. So we can track what a province is doing, what a district is doing, and at what implementation level they are at. And if there are any challenges or bottlenecks, those can quickly be identified and addressed so that that particular activity can be brought back on track and be achieved in an appreciable time period. So this tracking allows us to improve our implementation rate for all the key activities that the program does. So this is a screenshot of our Workplan Manager. It has been designed in such a way that it is easy for us to be able to follow what is going on with our work plan. We have our stratified objectives and deliverables and activities by thematic area. And these are divided into vector control, case management, our surveillance, monitoring and evaluation and research units, social behavior change communication, and overall program management. The tool also has clear start dates and the deadlines, and it has a color-coded progress and status explanation functionality where we can be able to track whether we are making progress with a particular activity or not, or making some progress in that regard. Then in order to increase accountability, in order to increase ownership and responsibility, each activity has a clear user or owner highlighted so that you can follow individually why certain activities are not moving along as anticipated. So the scorecard was rolled out in Zambia in March 2016. Currently, as I'm speaking, this scorecard is used in all the 10 provinces of the country and all the 116 districts. Currently, we are trying to see if we can use this functionality at a lower level, which is the health facility level. So we're trying to do a pilot in the Eastern Province in 4 districts to see if we can use this functionality at a health facility level. And with the establishment of the End Malaria Council, this particular scorecard has also incorporated the work plan of the council, and the council is able to also track on its deliverables. So the work plan has been integrated with the scorecard and the work plan on one platform, and all the various programmatic annual work plans included on that, including that of the End Malaria Council and the End Malaria Fund. What this integration has done is that it allows us to be able to check our progress, and we review this every month when we have what we call our directorate meetings. And on these fora, all the key partners participate, and we interrogate how well we are performing with regard to implementation of the various activities that we have on hand. Prior to the previous strategic plan, we had done an introspection as a country, and we found that our implementation rate was as low as 36%. After starting to use this work plan functionality, this implementation rate increased to 81%. The tool has harmonized all the work plans that are submitted by the various partners that work in malaria in Zambia. And this has allowed us to harmonize these plans and also appreciate the fact that we can work together as a team and ensure that we do not duplicate efforts with regards to programming, and use comparative advantages of the various partners that work in malaria in Zambia. So this screenshot just shows you what the scorecard actually looks like. It's color-coded. Red basically means that we're not on track. The yellow means that we've made some progress, and the green means that we're on track. We have selected key performance indicators that cover vector control, that cover case management and surveillance. And from this scorecard, you can be able to see what the national indicator is for those key indicators that have been selected. You can drill down to a province, and you can also drill down even to a district level. And this allows us to be able to interrogate where we are not doing well and put in measures to improve our performance. And this is part of the scorecard where we have our work plan functionality. As you can see from the screenshot above, each thematic area has a clearly outlined objective, and to address that particular objective, the various activities are then created and tailored to meet what that particular objective is. And from this particular functionality, you can have the work plan for the whole country. You can drill down to a province. You can also drill down to a district and be able to see what each district, each province's contribution is to the overall objective, and also whether they are on track or not on track with their implementation. So this screenshot essentially is highlighting how we input our activities. There's an overall arching activity in the bold, and then sub-activities that are associated with that overall activity that are placed right underneath that particular overarching activity. And each one of those has a specific date when it's supposed to be implemented and a specific date when it's supposed to end. And of course, we indicate as well who the users are or who is accountable for that particular activity. And then we can be able to track whether this activity is on track, whether we are off track, or whether we are making some progress. And this is just to demonstrate the overall performance. At any given time, if I draw your attention to the top most of the actual table, you will notice that you can have a summary of your overall performance with regards to the scorecard. So in this particular case, at the time when we took this screenshot, we had 21% of the activities had been completed, 1% had some progress, and 7% were not due, and overdue was 71%. So that meant that we needed to start interrogating why we had so many activities that were overdue, why they were not completed, and begin to quickly address those issues. And so that we would have more greens than reds, or more oranges than reds. So the key outcomes really of the scorecard is that it stimulates action to address any underperforming indicators. This is very important for us to be able to get on track with our programming. It also improves the level of accountability and transparency of the program and across the programmatic partnership. It also improves the decision-making processes of program management, and also facilitates engagement and resource mobilization by all partners. And as an example, we had used this scorecard, and we used this scorecard to present to the End Malaria Council the status of malaria programming. We had a situation not so long ago where we had challenges with availability of sulfadoxine pyrithamine, which is used in intermittent presumptive therapy in pregnant women. This was flagged by the scorecard, and that particular indicator was in red. And the chair of the End Malaria Council at the time, who happens to be the Minister of Health, asked why there was red. And within that particular framework, it was able to be discussed. The minister was able to make a commitment that government would make funds immediately available to address the situation. And because of that intervention, the other partners that were present at the time that were not intending to actually support the procurement of sulfadoxine pyrithamine also said they would relook at their budgets and their commitments, and then came back and were able to begin to support the procurement of sulfadoxine pyrithamine for intermittent presumptive therapy in pregnancy. So this is an example of how the scorecard can be used as an advocacy tool at a very high level for us to be able to address any challenges that may come on board. So in terms of next steps, every year we develop an annual work plan, and this is done initially centrally with all the partners at a central level. Then there's a trickle down to the provinces and then the districts. And then potentially in future, depending on the findings of the pilot, this will probably be done as well at a health facility level and also at a community level based on the findings of the pilot that we're conducting. We envision that at a community level, this scorecard will be used to track the activities of our community health workers or community health volunteers, review any key indicators at a more micro granular level, and also enhance discussions on how interventions are being implemented and how these if at all there are challenges, can be addressed within a community level framework. And of course, promote what we call community champions and champion communities, essentially populations or individuals that are like best examples of how we're supposed to be able to conduct our programming in those particular communities, and then hopefully influence positive behaviors towards malaria elimination in that community. We continue to always consult with our provincial health offices, our district health offices, and also the facilities on how we can improve this particular platform, how usable it is, and how easy it is to understand and to interpret, so that we foster its use at all these levels to improve our service delivery. We continue, of course, to do capacity building in this regard, and also conduct refresher trainings for those that utilize this particular platform. In order to push the envelope around improving the quality of care of health services, this tool is in the process of being adopted by a Ministry of Health multi-sectorial task team in terms of how this tool can actually be used to track quality of care at a community level. And this, of course, goes beyond just malaria, but essentially a health quality assurance or quality control platform to help overall health service delivery improvement. Thank you very much for your attention. Bye for now.